Hello everyone, welcome to Dr. Chan's Minor Ailments Forum today, and today I'm going to talk about a very common shoulder pain caused by what we call the frozen shoulders, or the medical name adhesive capsulitis. So I see that day in day out actually, people coming in and said, oh, I've done some DIY during the weekend and everything was fine, I didn't hurt myself, but gradually my shoulder has been really hurting and now I can't move it at all, and the maximum that I can do is kind of up to here, and then oh, now I've got pain, I can't do it anymore, and I can't put my arms to the back. So maybe as a woman they might say I can't put my bra on, or they can't brush their hair, or as a guy they might say I can't do my usual job, which is quite manual. And on examination they might present with really kind of frozen shoulders. They can't move their shoulders at all, and the range of movement has much reduced. Now why am I talking about this? Apart from the fact that this is relatively common, but it's also need early diagnosis to prevent complication down the line. So what causes frozen shoulders? Now, number one thing, we need to understand the anatomy of your shoulder. So you know you've got a humerus, which is the bone that kind of attach to the shoulder socket. So in order for the bone to attach to the socket safely, then you will have a bunch of muscles, what we call rotator cuff, to actually hold on to the head of the humerus like that. Okay, so to improve stability. So sometimes when you have a rotator cuff injury, then it can cause frozen shoulders. Sometimes frozen shoulder happen for no reason whatsoever, and sometimes immobilization. For example, you've been lying in bed for a long time and you suddenly realize your shoulder becomes stiff. That can also cause frozen shoulder as well. So the physical things that happen to frozen shoulder is the capsules that kind of cover the humerus is inflamed. So what happens is it will get really inflamed and painful, and eventually it will be contracting and turn leathery and restricting the movement. Okay, so let's just say you suspect you've got frozen shoulders. How does it feel like, and who's mostly affected? It's a very common thing that affecting anyone from 40 plus. Average age, we're talking about 50 to 55 years old is most common, and it's more common in women, which I really don't know why, but it just does. And so there are three stages of presentation. So number one is the early stage, which is painful and reduced range of movement. So you present it with really painful shoulders and you can't really move much. That can last up to 6 to 9 months. Second stage would be the pain gradually improves, but the mobility is still bad. So maybe less painful, but you still can't move your arms over a certain level. And that can go on for up to 18 months, if not longer. And after that period of time, you might enter the third stage, which is the resolving stage. So pain is gone and mobility gradually coming back, so it can go up to 3 years or so. So diagnosis wise, we don't need to do any x-ray really, because it's all kind of symptomatic, and when the GP look at you, they might say, yeah, we suspect that you've got frozen shoulders. Sometimes x-ray is needed if we don't think that is only frozen shoulders, maybe other elements in it. So let's say if this was diagnosed, then we generally would advise over-the-counter pain control like paracetamol, or non-steroidal anti-inflammatories like ibuprofen. And if they're not working, then we can escalate up to stronger non-steroidal anti-inflammatories or paracetamol and codeine combination for that kind of problem, but depends on people and depends on the symptoms. So number two thing is physio would be a good thing to do. People might think that, oh, my shoulder is hurting, I should rest more, but actually resting too much would hinder recovery. So we would always say gentle exercise, but not overdo it. So some people might go for pain control and already had physio and they're not doing anything for them. Then the next step might be referring to orthopedic surgeon for consideration of steroid injection into the joint. It doesn't always work, it doesn't work for everyone, but some people do find benefit from it. Generally speaking, after 2 years or so, nearly 90% of the people would have their mobility back and range of movement back to normal and pain-free. So number one thing that you need to take home is frozen shoulders, extremely common. Generally speaking, it will resolve on its own, but to get a better prognosis, it is best to be treated early with pain control and a holistic approach, so maybe physio or maybe even injection. So if you do have that kind of problem, I would strongly advise you to go and have a chat with your GP for further advice. So I hope that this little video is useful for you, and please don't hesitate to contact your GP if you've got further queries. Okay, take care for now, bye bye.